Good evening. I'm Lynn Fridley, Program Coordinator for Maddie's Institute. Thanks for joining us for this important webcast, Helping Cats Who Hiss and Hide, Assessment, Behavior Modification, and Rehoming Strategies for Shy and Fearful Cats. Our speaker tonight is Dr. Sheila Darpino, a board-certified veterinary behaviorist. Dr. Darpino graduated from the UC Davis School of Veterinary Medicine in 1996. In 2005, she was the first in the nation to complete a 3-year postgraduate behavior specialty training program through Maddie's Shelter Medicine program at UC Davis, with an emphasis on shelter animals and shelter behavior program. Afterwards, Dr. Darpino implemented that behavior training at the Sacramento SPCA and at the Animal Rescue League of Boston. We were very happy to have her join Maddie's Fund recently as director of Maddie's Animal Care Center, which is being built in Pleasanton, California. Before we get started, there are a few housekeeping items that we need to cover. Please take a look at the left-hand side of your screen where you'll see a Q&A window. That's where you'll ask questions during the event. Dr. Darpino will answer as many as she can at the end of the presentation, but please submit your questions early. Questions submitted in the last few minutes will not be processed in time for a response. If you need help with your connection during the presentation, you can click on the question mark, which is the help icon at the bottom of your screen. There are other little images along with the help button. These are called widgets. The green file widget will take you to the resources that our speaker wanted to share with you, as well as information from Maddie's Institute. Before I turn things over to Dr. Darpino, I'd like to say a few words about Maddie's Fund. We are the nation's leading funder of shelter medicine education, and it's our goal to help save the lives of all of our nation's healthy and treatable shelter dogs and cats. The inspiration for that goal was a little dog named Maddie, who shared her unconditional love with Dave and Cheryl Duffield. They promised her they would honor that love by founding Maddie's Fund and helping make this country a safe and loving place for all of her kind. Please use what you learn here tonight to make the dream she inspired a reality. Welcome, Dr. Darpino. Thank you for being here tonight.
Thank you so much, Lynn, and thank you everyone for attending. I'm really happy to be talking about fearful cats tonight, and really happy about so many people who are here joining us and so many of you who work to help these cats who so sorely need our help. You can see on our introductory slide is probably the only slide in this presentation that is not a cat, but that is cute little Maddie. I'm going to start the lecture here with a poll, in that you gave us some information when you signed up for this webcast, but I'd like a little bit more information that will help me direct the flow of this lecture.
So what type of organization do you work or volunteer for? Is that a municipal organization with a physical shelter, a private nonprofit organization with a physical shelter, private nonprofit organization with foster homes and no physical shelter, or not applicable? Please answer on the screen, not in the Q&A box. Answer on the screen and click on your answer, and we'll be going to the results shortly. So what type of organization do you work or volunteer for? Okay, we'll go on to the results and see what we have. Well, that's interesting. 47% are private nonprofit organizations with a physical shelter. A municipal organization with a physical shelter is 14%, and we have foster homes, 29%. Dr. Darpino, that's pretty good showing across the board.
Hello.
And I guess we can move forward.
Oh, this is Sheila. I lost my audio for some reason for a minute, but I'm back. Thank you for moving.
Okay, I'm advancing forward.
Thank you, Lynn, and I can see everything. Everything's working just fine.
Good.
All right. So thank you all for sharing that information. That was very useful in terms of directing the rest of what we're going to talk about. Helping cats is why we are all here, and as we do better at saving lives, we are so, so happy to focus on those cats who previously would not have had a chance in many, many shelters. And in addition, we're also focusing more on cats out in the community, whether they're stray cats, feral cats, or cats in poor living situations, as you're going to see on the next few slides. And as we look at this news story here, this used to be the norm. When we had a hoarding situation, oftentimes the animals, cats or dogs, from those situations weren't saved. And I'm not passing any judgment on the organizations that were part of these stories, because I don't know the backgrounds of these stories and the situations, but this was really the norm, that we weren't saving animals in these situations. And instead, we jump to today, and more often, we're seeing rescue organizations saving these cats and kittens in these situations, which is so, so exciting to see. And especially communities, pet owners, and humane organizations, law enforcement, all working together to save lives. And we're achieving success with these. This is a follow-up from that last slide, and this was the last of the cats. And they had a big marketing campaign for cute little Annie, who you see there, who was the last of the cats in that case that they were looking to find a home for. So we're having success. We all know a lot of these cats from hoarding cases can be very, very fearful cats, and that's why I brought this case up in relation to the discussion today. We're having success, but there's still a lot that we don't know. And that was one of the reasons why we asked many of you to complete a survey regarding your experiences with owning or fostering fearful cats. So we weren't looking at fearful cats in shelters. We were looking at fearful cats in foster homes and seeing what people did and what happened with those cats. And I'm going to begin by presenting some of those results. Some of our questions are, what is the best way to care for and work with these cats? What works, what doesn't? What are we most versus least likely to be successful with? So we're going to jump to the first results of this survey. Remember, as I go through these results, that these results are preliminary. So we're going to be sharing the results with you after this webcast is over. So when we send you a link to the recording, you'll also be getting a summary of the results that Amber is so kindly compiling for us. A lot of you participated in this study, and the first question just asking if you had ever owned and or fostered an extremely shy or fearful cat. And we had over 1,000 people who responded to this saying yes. And so that was our main sample for answering the questions in the study. We looked at the age of the cats in the study. So if you fostered or adopted, how old were these cats and kittens? And you can see that about a third of them were less than 12 weeks. About a third of them were between 12 weeks and a year, and about a third were greater than a year. And when we're looking at working with these cats, age is very important, and especially with regard to socialization, because once they get past their socialization period, working with these cats can be much more difficult, or kittens can be potentially much more difficult. We're going to be talking about that a little bit later, but I'm going to start with a poll so we can see where our audience is in terms of knowledge about kitten socialization periods.
What is the socialization period for kittens? Select the most accurate answer. 2 to 7 weeks, 3 to 13 weeks, 7 to 16 weeks. A socialization period has not been identified in cats, and don't know. So please select your answer in the screen, not in the Q&A box. 2 to 7 weeks, 3 to 13 weeks, 7 to 16 weeks, or a socialization period has not been identified for cats. So we'll go to our results and see what people are saying. Dr. Darpino, what do you think of those results?
Great. We have answers pretty evenly divided between 2 and 7 and 3 and 13. That was about what I expected. 3 and 13 weeks is actually the socialization period for dogs. cat socialization period is actually much shorter. So it's going to be surprising for some of you to know that kitten socialization period, where we should be exposing them to everything and anything that we want them to be exposed to in a positive way in life, is between 2 and 7 weeks. So it's very early, and so if we don't work really, really hard very early on, oftentimes it's really hard to make up ground later on. Great. Thank you, everyone, for answering that. All right, so getting back to our survey results. So we talked about the age of the cats in the study, and the next question we looked at was whether people owned or adopted or fostered the cats. And it was pretty evenly divided. A third of the people owned their cats or kittens, a third fostered, and a third fostered and then eventually owned. And this next slide, looking at how long they had the cat, this slide represents foster homes only. So if you look at the number of people who answered that, it's 368, because I didn't include people who owned or fostered and then owned, because obviously they're going to have the cats for much longer. So when we looked at foster only for this, we can see that the majority of cats and kittens were in foster for 1 to 3 month time period. So we can potentially interpret that as the length of time that these cats were needed to work with to be adoptable, or what people would consider adoptable, and that also fits with some of the results that you'll be seeing later on. But there also are potentially other factors in terms of why they were in foster, if they had medical problems, if they were an underage kitten. So this is not only based on treatment. It's important to note that 75% of the cats and kittens were in foster for more than 1 month. So this is not, as many of you probably know, a short-term thing to do for these kitties. And when we looked at the length of time in foster based on age, it wasn't surprising that I learned that if you were a younger kitten, you were in foster for a shorter period of time. So older cats stayed in foster longer, which implies that either they were more difficult to find homes for, or they were slower to respond to treatment, or both. And so when we looked at kittens in the 4 to 8 week old range, 15% of those were in foster more than 3 months, as opposed to cats that were between 6 months and a year old. 55% of those were in foster for greater than 3 months. So as age increased, length of time in foster increased. And the next thing we looked at was approximately how long it took until the foster or adopter was able to first interact with the cat. And you can see on this slide that 55% of them interacted in less than 2 weeks. So first time to interact with the caregiver, the majority less than 2 weeks, but not less than 1 week. And when we looked at the time to interact based on whether it was adopted, fostered, or fostered and then adopted, you can see that there was not a huge difference between those 3 different groups. The majority were less than 2 weeks for that first interaction. Although we do see that there is a small subset of cats who they never chose to interact with their caretaker. So some of these cats don't respond, and is that 63? And you can see that 51 are more than 6 months. So there's another group that took a really long time. And so are these cats that take a really long time cats that aren't going to respond and don't have the ability to respond? Are these cats that we need to change our behavior modification plan? I don't know the answer to that, but there are some cats who didn't. The next question was approximately how long it took until the cat left the room it initially stayed in. And when we look at that, we see that approximately 60% left the room in less than a month. So the majority were less than a month, but only 16% at 1 week. So it definitely took time. And alternatively, we saw that approximately 9% of cats, or a little less than that, took more than 6 months to leave the room they were in for the first time. and some cats never voluntarily left the room. And there's another category, that last category is cats that were not allowed to leave the room. And obviously some people preferentially, if they have other cats in the household, don't let their foster cats associate with other cats. And I would guess that that's probably that issue, and or other environmental issues like dogs in the house. All right. And so we just talked about how long it took until the cat was comfortable in a room. The next question being, how long did it take until the cat was comfortable in the entire house? And I removed the subset of people who didn't allow the cat to leave the room from this situation. But you can see when we look at this that 46, or about half the cats, became comfortable in the entire house in less than 3 months, but it did take up to 3 months for the majority of cats. But a third of the cats took more than 6 months, and 182 cats out of 945, it looks like, never became comfortable in the house. And so this is very important information, and one of the many reasons I'm so glad that we collected it is that some cats do well within 3 months, but some cats take much, much longer. And so these are oftentimes very long-term foster situations if we are going to be successful. And there's a lot to think about and discuss with regard to treatment and adoption with regard to that. We'll get to that later. And the next slide is about outcome here. So this was once again foster only because we know the outcome of the people who fostered then adopted or adopted to start with. But these were just foster. And when you look at the pie chart there, the pieces that are in red or orangish color are all options where the foster person kept the cat or found an option for the cat. So in 70% of cases here, the foster was the key person in terms of finding this cat or kitten a home. And so good for all of you who fight for these kitties and work so hard to find a good home for them. The green pie is the shelter found a home for those cats. Can we change these numbers? Can we increase the number that are finding home through and in the shelter? Potentially, yes. Potentially we can do a better job, but there's a lot more research that we really need to do related to this. That I'm really proud and happy to say that that tiny black sliver there is euthanasia. Only 3 cats of everybody who answered this study was euthanized, and it just makes me so happy to see how the world has changed and how that number was so very, very low. So these were part of the results of the survey. We're going to move on now and talk about assessing these kitties and treating them, but we'll talk about some of the other results later. First, we're going back to talking about socialization. Preventing problems from occurring is often easier than treating problems once they're there. Right now I'm going to talk to you about a recent study about the effects of handling during the socialization period on the development of behavior problems and the cat-owner bond. This was investigated in kittens homed from rescue centers in the United Kingdom. 37 kittens. They were all born at the center or surrendered to the centers. I said center, it should be centers, at less than 2 weeks of age. And kittens in the 3 centers were given either a standard handling and socialization like most organizations do in terms of feeding and cleaning and minimal interactions, or what they called an enhanced socialization between 2 and 9 weeks of age. What that enhanced socialization included was a gradual program of increased handling, contact with a minimum of 4 different people, including at least 1 man and 1 child, exposure to noises, exposure to a friendly dog. And so that was their enhanced socialization program. And when the shelters that were, or the rescue centers that were involved in this study, they were taught how to perform the socialization and encouraged to participate, but a number of the shelters unfortunately withdrew from the study over time because they were unable to provide the socialization which was recommended, which was really sad, but not shocking and surprising for me in that it can be very, very difficult unless you have a very strong and powerful volunteer base to provide the socialization that is really needed in the shelter environment. But the kittens that did participate at 3 rescue centers received an average number of 39 days of extra handling by about 4.5 observers. And about half of the extra socialization group were exposed to dogs, but only about a quarter were exposed to the special noises that they were supposed to expose them to. All of the kittens were then homed and their owners were interviewed when they were approximately 1 year old. The owners of the additionally socialized kitten reported significantly higher emotional support from their cats, and fewer of these cats exhibited behavior indicative of fear of humans compared to cats that had received standard socialization. So this one study in the United Kingdom demonstrated that an enhanced socialization program in a shelter can potentially be beneficial to shelter kitties. So that was nice to see. So when we talk about shelter socialization programs, however, I mentioned that the majority of shelters dropped out of the study because they weren't able to fulfill what was needed in the study. And so that's very challenging and frustrating. And so is it practical to have socialization programs, or is foster the answer? I think if we are going to provide socialization, crucial socialization for kittens in shelters, it needs to be planned socialization like is in this study, and it needs to be something that's tracked. We keep data on whether our staff and volunteers are meeting the needs of these kittens, and if they aren't, we really, really need to send these kittens to foster where they're going to get the interaction they need to increase the likelihood of developing into healthy adult cats. Prevention is the easy part, though. It's easier, I should say. What about older kittens and cats? We're going to talk about different types of cats. And when I'm talking about different types of cats here, I'm not talking about different colors of cats. But what I'm talking about is different backgrounds of these cats in terms of friendly behavior. So I'm going to divide them up into household cats versus community cats. Hopefully the term community cats is a term that you've heard before, but these are cats that are living outdoors. Both of these categories of cats may be friendly or unfriendly. So I'm sure you all know unfriendly household cats, unfortunately. But with regard to the community cats, we have the same thing, some friendly, sociable cats and some unfriendly cats that may or may not be feral. The category of cats that we're going to be talking about today are obviously the unfriendlies and the focus here. When we think about community cats, however, it's a topic that's on all of our tongues these days, and we really need to think about our shelters or communities' live release rate for cats. And is a shelter the best place for a cat who isn't comfortable living in a home? Where we already saw the data just a couple minutes ago that shows how long these cats take to respond or may take to respond in a home environment. In a shelter environment, it's almost certainly going to be much, much more challenging and probably inhumane for them to live in those conditions because it's so stressful for them. And so what I'm suggesting, and many other people have suggested, is that when we are working or you are working in a shelter with a live release rate that is less than we would like it to be, we need to strongly consider whether the shelter is the best place and whether these unfriendly cats that come from a community situation where they're in good health and had a good life, whether those cats should actually be staying out in the community and living out their lives in that situation. The links there on the bottom of the slide are 2 webcasts about community cats and community cat situations that I definitely suggest you watch if you're unfamiliar with this situation. We're going to talk about intake now and categorizing cats. So when a cat comes in, how do we decide if it's friendly versus unfriendly? How do we decide if it's a feral cat that should be released versus not? There's a number of different things that we can look at. We can look at the cat's physical appearance. The cat that you see here on the slide is a cat who doesn't have the best physical appearance. He certainly looks like a cat that could be an outdoor cat and probably was an outdoor cat. We can look at behavior, but how good is behavior at telling us whether a cat is going to be a feral cat versus not a feral cat? We can look at response to treatment. So next we're going to watch a video about the cat you just saw in the last picture. And so this kitty was a kitty who was not in great shape when we first met him. He, as soon as the person started interacting with him, he started eating. That's probably a good sign that despite this cat's poor condition that makes him look like he could be a feral cat, that he's probably not, because he is socially facilitated by the person there, and the person's making him more comfortable and encouraging him to eat, or potentially so. Either that or he's a resource guarder, but probably not. That's not something I see very often in kitties. And then we have our veterinary student interacting with him, and you see friendly behavior there. So physical appearance, we certainly can't go, and I'm sure we all know, we can't go on physical appearance alone in terms of deciding whether a cat is going to be feral or not feral. And that is why the ASPCA has done a lot of research on fearful versus feral cats, trying to help all of you out there determine whether a cat is feral and should be re-released versus just fearful, and there should be an attempt to treat. And so the ASPCA looked at differentiating socialized versus unsocialized cats. These cats were evaluated 4 times over 3 days. On day 1, they were evaluated in the evening. On day 2, they were evaluated morning and evening. And on the 3rd day, they were evaluated in the morning again. Socialization was defined by friendly and relaxed behavior towards people and not aggression, whereas the unsocialized were extremely frightened of people and unaccustomed to being around them. So these may or may not be feral cats, the unsocialized cats. They may just be cats who don't like people very much, or are very fearful of people, or are very stressed by new environments. The gold standard was a questionnaire that was answered by the caretaker, who had to be familiar with the cat for at least 1 month. They did a basic evaluation, which included greeting and extending the hand toward the cat, opening the door just a crack and then closing it, jiggling a string toy at the kitty, stroking the cat with a wand-type toy and pushing down with that with a rod. And that was the evaluation that they did and used to try to assess feral versus, or I shouldn't say feral, sorry, socialized versus unsocialized kitties. Interestingly, a lot of us, or many people, will look at aggression and think that aggression is a good way to distinguish feral versus not feral, and that definitely didn't prove to be true in this study. Hissing and growling and the occurrence of those behaviors did not distinguish socialized versus unsocialized kitties. However, they did find behaviors that identified socialized cats. So if a cat demonstrated one of these behaviors that you see here on the screen, it was definitely a socialized and friendly kitty. So at any one of the assessments they did one of these behaviors, they were socialized. When we look at the word touch, I want to define it for you. Touch was an attempt to touch a person or the toy. The toy solicited lots of touching in this study. The chirp or chirrup, as it's also called, we're going to show a quick video of that vocalization. So there we go. So that's our chirp noise, one of the behaviors that if a cat does that behavior, it's definitely a socialized cat in this one study. They looked at a lot of other different things that they found were not predictive one way or another, but they did find a combination of behaviors that if a cat displayed 4 of these behavior in any combination. So it could have yawned 4 times over the assessments, or it could have yawned and groomed itself and sniffed and rolled. Any 4 of those, that defined a socialized kitty as well. The still standing or still moving, what that means is that the cat was still standing or still moving around the cage at the end of the assessment. So the ASPCA, and I had a link to their webinar, and they have 2 webinars actually about this research, and hopefully it's something that will be published soon, is in the process of doing even more research about this factor that is very useful to all of us. And so we have behaviors that tell us about socialized. The rest of our kitties are unsocialized, and that doesn't necessarily tell us feral versus just, I shouldn't say just, versus unfriendly and not comfortable being around people. We can also talk about what's the importance of feral versus not. If it's a stray cat that came from an outdoor situation, is it a truly feral cat versus a cat that just is really, really stressed? There's a lot of nuances to the whole situation of unsocialized cats, and some of these cats do really well, some don't. So next we're going to look at a quick video of some little kitties, and I want you to watch this video thinking about behaviors that these kitties are displaying and whether you're seeing any of those behaviors that you saw on the list of social versus not social behaviors. I hope you wrote them all down and remember them all. I know you didn't. But let's watch this video and look for friendly social behaviors. All right, a litter of kitties at the Animal Rescue League of Boston. So far, not seeing very many friendly behaviors. And so initially just some talking to the kittens to see how they respond to voice, and then tapping fingers to see how they respond to some tapping fingers. And we're seeing frozen little kitties who are either really tired, which I doubt because their eyes are wide open, although I can't tell, one of them might be closed, or they are very worried about that person right there who's wiggling her fingers to see if the kittens want to interact. She moves them closer. We get a backing up, a little bit of vocalization, but we're really not seeing any behaviors in this video of these little kittens. That doesn't mean that these kittens can't respond to treatment and that we shouldn't work with them. We certainly should, because these are they are young kittens and they're getting closer to the end of their socialization period, but they certainly have the opportunity to respond, or the ability to respond, I should say. All cats really do, right? And then she pulls out a toy and wiggles around a toy, and we see the kittens start to show some interest in that toy. And certainly one of the things that many of you reported, in my experiences as well, is that many of these cats, one of the first things that we get them to do in our presence is show interest in play. And in my experience, that's primarily when we are playing with a toy that's extended from us so that our hand is not right next to them. All right, so that was a quick clip looking at social versus not displaying social behavior. The next thing we're going to talk about is fear versus anxiety. I feel that it's very important to talk about this because when we talk about fear, fear is an adaptive, physiological, and behavioral response to a real threatening stimulus. The physiologic response ends when the stimulus is no longer present. So it happens in response to a stimulus, the stimulus goes away, the cat's happy again. Whereas when we talk about anxiety, anxiety is a profound physiological and behavioral response. It's apprehensive anticipation of a stress-provoking or fearful event. So the cat, well, we don't really know what they're thinking, but people who experience anxiety worry about this scary thing potentially happening to them. So there's the interpretation that in animals who are anxious, they are experiencing worry. This thing that they're scared of may or may not be at real risk of occurring. And this unpredictability leads to chronic stress and tension. So let's look at this next video of a cat, and then we'll talk a little bit about fear and anxiety and what we think this cat is experiencing. This was a cat, I can't remember his name, but he hadn't been in the shelter for a very long period of time. This video was taken several years ago before, this is the Animal Rescue League of Boston, before we converted to all double cages, so they had a porthole to go through and have more room to move around. But we can see a kitty with dilated pupils, not moving around. As the person's hands get closer, he does a little sniff and a look at her, which was an encouraging sign to see. And then she lifts up his chin to pet him. And he doesn't seem very happy about that. Is this a social versus not a social cat? I think there's a big factor in this video that many of you could probably name if you could speak to me right now, and that is the barking dog in the background. Unfortunately, this is an older shelter that has a hard time they're separated by doors, but separating the sound of the dogs to the cats. And that barking dog was probably extremely stressful to this kitty. And in fact, we moved him to a quieter location away from the dogs, and he was a completely different cat. So this cat, he looks like a cat who could be experiencing anxiety, and he may very well be experiencing anxiety, but he was probably experiencing fear because he heard that dog barking in the background and was worried that dog was going to get him. All right, we're going to talk a bit about stress and kitty stress. When we talk about stress, there are many, many different signs of stress. There are many different causes of stress. And you see a couple ideas in terms of potential causes of stress for our feline companions. When we talk about signs of stress, sometimes we see inhibition of behavior, like the cat you saw in that last video. He was not doing much at all. You could tell he was terrified by the fact that he was not moving in his dilated pupils. But his behavior was very, very, very inhibited. But some cats and some dogs do exactly the opposite, that when they're very, very scared, we see behaviors like aggression. And fear is certainly the primary cause of aggression in our shelter cats. There are a lot of other signs that we can see associated with stress. So really, really common for cats to lose weight when they first enter a shelter environment. And we have research to demonstrate this now, that how common it is that they lose weight during the first couple days in the shelter, and almost certainly due to inappetence related to stress. Interestingly, the ASPCA's research found that most of the cats in their study were eating at night and using their litter box at night. So can't overstress the importance of feeding these guys in the evening so that if they are eating at night, they have fresh food. All right, and now we're going to watch a little video of a stressed kitten. This was my kitten, Junior, little cute little guy. I fostered a litter of kittens and adopted this one. And he was actually in a veterinary hospital. You see him run away right there. He just saw a dog. And I'm trying to do a little pat on his rear end. That's something that I sometimes do in behavior assessment with cats because it's something that some cats love, some cats hate, and I want to see how they respond. Junior's a little bit unhappy with me, but he was primarily interested in that dog. You saw he turned around and focused right towards where that dog had come. And so something really important to point out with regard to doing behavior assessments, and do I recommend doing behavior assessments with these fearful cats. Junior wasn't a fearful cat until he saw the dog in the background. But because fear causes such an extreme change in behavior, I recommend doing a brief assessment like the ASPCA does, so we can get some basic knowledge about their behavior without moving them around a whole lot, because we know that moving them is stressful, but getting some basic information that's going to help us to decide on next step for these kitties. So for fearful kitties, I don't get a whole lot, and especially fearfully aggressive, I don't gain a whole lot of information by doing a formal extended behavioral evaluation with them. Reducing fear in the shelter environment. That is a big reason why we're all here. What can we do to help these cats? The biggest part of what we're going to talk about today is getting them out into shelters and into foster homes. That's oftentimes what we need to do. But other things that we can do to maximize their health while they're with us are things like consistency. So feeding at the same time, cleaning at the same time, reducing the noise in the environment, especially dog noise. One study published in JAVMA found that dog noise was the most stressful, or one of the most stressful factors for cats in our shelters. And decreasing our population density. Petra Mertens, who used to be she's a veterinary behaviorist, used to be at San Diego Humane Society, certainly found that exposure to other cats for these fearful cats was a factor that really increased their fear. And that's been my experience too, that moving them to a location where they're not around other cats. They're also not around a lot of other things. These tend to be quiet offices, but they do much, much better. So consistency, reducing the stimuli in the environment and creating a quiet environment is so, so important. When we talk about housing of these cats, we want to make sure they have adequate space. So I talked about those double-sided cages that the Animal Rescue League of Boston now uses. That's certainly a start. Putting them in an office like you see with the kitty in the upper left-hand corner. He's in an office at the Animal Rescue League of Boston. Obviously still a little bit fearful, or a lot bit fearful, but he has a lot more space to move around and get away from things now, which they tend to respond much better for us when we can get them into an office situation. And obviously not everybody has that opportunity, but use the space that you can when you can, and that's also, as I said, when foster homes come into play. Separating them from other cats when they're stressed by other cats, and as we said, many of them are in this environment. They don't know these cats, and it can be very stressful to them. Providing them with a hiding place. So you see both of these kitties are hiding. It's for some shelters, like the one in the bottom right, it's as simple as a paper bag, but we can have very elaborate hiding environments for these kitties, as well as the ability to get up high. The ability to get onto shelves and up high is something that cats definitely use when they're fearful. Next, we're going to talk about handling. In terms of handling these cats, we want to minimize movement of them. So spot cleaning is what we recommend when they're in a shelter environment, so that we're cleaning and tidying up the cage environment but not moving them out of the cage to clean the cage environment. Minimizing their movement, ideally if an examination or treatment is needed, doing it if at all possible in the area where they are and not moving them a whole lot. Using wand toys to interact with them so that you can interact with them safely. So I talked about the ASPCA research where they used a rod to interact with the cat initially, and I've certainly found that's a great way to initially interact in a way that usually a wand toy coming at them, for some cats are going to find that terrifying, but a lot of cats have positive associations with that. So it's usually a more positive something coming at them, and almost as importantly, it's not a hand that can potentially get bitten or scratched or that type of thing. We want to be very aware of body language in terms of handling these cats, and being aware of body language is what oftentimes keeps us safe. And this next video that we're going to watch here is courtesy of Jacqueline Munera, and she has produced a DVD called What Is My Cat Saying? It's actually our door prize today. It's a great body language DVD, and we're going to be watching a video which is going to show this kitty's behavior, and then I'm going to ask you a question about these cats via poll. All right, here goes. So watch this video. What is this cat saying to you? All right. And here's our next poll.
What best explains the motivation of the cat in this video? Play, fear, aggression, attentive interest, don't know. Dr. Darpino mentioned the door prize that will be given out to 10 lucky winners of that are attending the live event tonight, and we'll contact you via email. So please answer our poll. What best explains the motivation of the cat in this video? Please get your questions into the speaker. We don't want them to come in at the end, and we wouldn't be able to respond. So if you have a question, please submit. And here are our results. What best explains the motivation of the cat in this video? Well, I think most people think that it's attentive interest and maybe some fear. Dr.
All right.
Darpino?
Thank you so much, Lynn. And this is why learning and talking and thinking about body language is so very, very important. This cat is experiencing fear and is displaying fearful body language. We're going to show that video again so we can watch. So 30% of you got the right answer there. But I can understand, unless you're watching very, very closely and looking for subtle cues, I can understand why many of you selected attentive interest. We're going to watch the video again. This time I had edited out the little pre-part of the video that talks about this cat's body language. So we're going to watch it again. All right, my slide is being a little slow to advance right now. There we go. So you can see that Jacqueline listed the items there that are demonstrating signs of stress in this cat. They certainly are subtle, and that's the challenge of our cats, right? In that a lot of this cat is a scared cat. It'd be interesting to hear from Jacqueline, who actually is here today in this webcast, but she cannot speak what that cat was actually looking at and interested in. But that cat was definitely fearful. And so learning about body language and recognizing that that cat is fearful so that we can approach it carefully, so important, and why learning about body language is so important. And along that line, I'm going to give you a couple of resources here for feline body language. So the What Is My Cat Saying? That is Anne Sophia Yin's Low Stress Handling book and DVD. Both of those are available at dogwise.com. Despite being available at dogwise.com, there is cat information there. And then the ASPCA Pro has webinars about humane feline handling and feline communication, which I also encourage you to watch.
And I'd like to add that, excuse me, Dr. Darpino, these are also in the resources in the widget where you can purchase these items and where you can find the ASPC Pro webinars. And they'll also be on our website after this presentation.
Great. Thank you, Lynn. So now we're going to get into talking about treatment. And I'm going to jump back to the survey. This is a cute little kitten from the Animal Rescue League of Boston. But jump back to the survey that many of you answered, and we had a write-in question that looked at what people did when they worked with these cats. And this is just a summary of some of the things that people did. So people did things like move slowly. The bigger words are things that happened most commonly. And so the interact is very big. That word was selected as a word that was used more commonly. It was usually used in association with interacted on the cat's own terms or gradually increased interaction over time. So lots of treats, food, providing the cat with hiding places. Lots of wonderful things were done for the cats from the people who reported what they did for this study. So what do I recommend in terms of treatment? This is cute Lance. And step one in our treatment is reducing stress. And there's some great webinars about reducing stress and enrichment. Kelly Bolin has one at with the ASPCA Pro webinars, but there's a lot of them out there for kitties. I'm not going to spend a ton of time talking about that today, but the big things that we want to do is avoid the items that the cat is so scared of. So if the cat is primarily scared of people, we want to put that cat in an environment where it's not going to see a ton of people. We want to decrease noise, decrease movement. We want to increase friendly and non-confrontational signals. This was something that was fairly commonly reported amongst people who responded to this survey. So blinking, avoiding eye contact were things that people found helpful to reduce kitties' fear. Be great to have controlled studies about that in terms of how it helps. Increasing structure and routine, certainly another good thing to do, and decreasing lots of activity. So quiet, calm behavior around these kitties, so important. Going to watch a video next of attempts to reduce stress in action with our cute kitty Lance, who you just saw. And here's Lance at the Animal Rescue League of Boston. You see him licking his lips and not moving. Body tightly hunched up, more licking his lips. He's not hungry. He's a stressed kitty. And that's what Lance did initially. He was very stressed and uncomfortable. And so Lance, the lucky kitty, got moved up to an office foster situation where he had a whole office, one person in that office, and a whole lot more space, a hiding place, multiple hiding places. And so you see him in his office there. He's still not moving much. He looks like he might be more comfortable because he's in a bed, but still not moving much. Staff and volunteers spent time with him in office foster. An attempt to get him. He's showing a little bit of interest in that toy there. After 2 weeks, he did not respond quickly, but typical for a lot of these cats, it can take a while. A lot of our cats in office foster, my experience was that they responded within a week, but it wasn't uncommon that it took 2 weeks. And you see cute little Lance meowing at us there. Within 2 weeks, he wandered around. And eventually he went to a home foster situation with Debbie, the person whose office he was in, and he turned into an absolutely normal, happy, wonderful cat who actually got into a lot of trouble because he was so outgoing and extroverted in her home environment. So he did really, really well. So getting them out of that cage, so important. Would he have responded the same if we had kept him in that same cage environment for that long period of time? I can't tell you the answer to that because we didn't do that with Lance, but I can tell you with cats that do get kept in that for that long period of time because we don't have an office for them, some respond, some don't. Just being in those small cages when you're really scared is a horrible place to be. All right, so going on with treatment. Step 2 of our treatment. So step 1 is reducing stress. You saw our attempts to do that with Lance. Step 2 is creating positive associations via classical conditioning. So a lot of you who responded to the survey used treats and food. We use classical conditioning in this step, and you can see this drawing, which is courtesy of Lily Chin. You can utilize her drawings at doggydrawings.net. I apologize that she does not have kitty drawings, but it does demonstrate classical conditioning and changing this dog's emotional association with the bell. So initially the bell he may have had no association with at all, but when they associate that bell repeatedly with food, when he hears the bell ring, he thinks food and he's really, really happy. We're doing the same thing with our fearful cats. And that's my next part of treatment, is classical conditioning. So usually for me this involves multiple meals per day, going in the cat's area, putting food down, and then leaving the cat alone. So when these cats were in my office, I ignored the cats completely. I'm not forcing interaction. I'm just ignoring them completely and creating those positive situations. Does giving the food, even if the cat doesn't eat it, help? I don't know. That's another thing we could do some research on. Step 3 of our treatment plan, I already actually just mentioned it, but is to be patient and not force interaction. And another thing that many of you who responded to the survey mentioned, we need to pay really close attention to body language and progress at the cat's pace. So if the cat is getting comfortable with us and showing behavior and body language signs of comfortable, then we increase the intensity of our interaction. But if the cat isn't, we still stay at a very low level, just giving the food and backing off and moving away until the cat starts showing more comfort. I oftentimes get the question, should you ever force? If you're patient and not forcing interaction, some of these cats never come forward and start interacting with you. And my answer to should you ever force, it obviously works sometimes. I know people who do it and certainly do it successfully, but I've also seen it backfire many times. And I've also seen that cats can very, very significantly remember a one-time experience of being forced and terrified, and that can eliminate the possibility of progress in the future, because they're so stressed by a situation where they were forced to do something in a very small way, but it breaks that bond of, well, I don't know what actually is happening. My guess is that it breaks that bond of trust that they're starting to form with us and makes them very, very resistant to attempting to respond. So I do not recommend force. Next, we're going to talk about Giselle. Giselle was the kitty that you saw in that last slide. Giselle in 2009 was a cat that came in today from a construction worker who had found them in a home where a woman had passed away. And they couldn't get any information, but the kitty was very fearful. And she stayed in the shelter for a decent amount of time, but she was then adopted. And Giselle was then returned in December, so about a month later, for fearful behavior in the home. Her intake notes noted that she was fearful, hissing and growling towards all family members and the cat. Notes that she bit a child in the home who was 7 years old. In hindsight, it probably wasn't the smartest idea to send this kitty home with a child unless it was a very calm and quiet child. I don't know many children that are calm and quiet, but I'm guessing they certainly exist. They noticed occasional house soiling. They noticed she had scratched and broken the skin. So she was put on quarantine when she came back to the shelter. She was identified as fearfully aggressive toward people. Because she had done fairly well, she was fearful, but had done fairly well the first time around, and we always like to get to the bottom of the story and find out what's going on and give kitties a chance and find them a home. We placed her in office foster to gain more information about personality and evaluate her litter box habits. And so similar to Lance, Giselle stayed in the office foster in the office situation 24 hours per day. We created those positive associations. We allowed her to approach on her own terms. We petted and touched her only when she solicited it, and when she did, we interacted for just a few seconds and then take a break, because a lot of these cats respond negatively to long periods of attention, especially initially. And Giselle did very well in office foster. She started interacting with and enjoying pets from her caretaker. She had no further inappropriate elimination. So we suspected that the inappropriate elimination was due to fear of moving around the household and that there wasn't a litter box close to where she was staying and hiding. But we couldn't be 100% certain of that. But she did very well, and we decided it was time to place her for adoption. Happy ending story here. Giselle was adopted just after the new year in 2010, after being in the shelter for only 24 days the second time around, to a shy and quiet couple. And Giselle was shy in her new home, but her equally shy owners were very understanding and patient. And that's a big thing we really try to do with these adopters is find adopters who are understanding of a shy cat, because if you're a shy person, and I consider myself to be a shy person, you tend to be very understanding of other shy animals. Giselle certainly took several days to be comfortable in her new home, but did well, and her adopters are very happy with her. So that's just one little case report there about Giselle. The next thing I'm going to talk about with regard to treatment is foster. This is a cat that I fostered for the Animal Rescue Foundation in Walnut Creek, California, probably about 8 years ago now. I can't remember her name, but she was a beautiful cat with one blue and one green eye. And for many of these cats, getting them into foster is critical. This was a fearful cat who had been in the shelter for a very long time. She'd been in the shelter for about 6 months and just wasn't responding. The shelter is just way too stressful for so many of these cats, and they don't recover. Their welfare is so severely impacted, and the likelihood of anyone choosing them, this cat was aggressive because she was fearful, the likelihood of anyone choosing them with that behavior is very, very small. But who goes to foster and who doesn't? So can we save them all? Yes, I hope we can certainly save them all, and that is our goal. But deciding who goes to foster, who gets released into the environment, who stays in the shelter environment is really going to depend on your organization, your capacity for care, your number of foster homes. Building up our number of foster homes that are able to care for these kitties is absolutely critical. Treatment of these cats is, in my opinion, I don't have research to support this, but really influenced by personality. We see the 3 cats in the slide here. That black and white kitty was a fearful kitty, but she was a pretty confident kitty. She was one of those cats who, in the shelter, she didn't move at all around very much at all, even in a large community room. But once in my home environment where she didn't have to see other cats, she was a very confident, active cat. She just didn't like to be touched very much. As opposed to Elwood, the cat on the bottom there, he was a very, very confident and friendly cat, very outgoing overall. And as opposed to the orange tabby up there, a fearful cat who's more inhibited and has a whole lot less confidence is very uncomfortable in almost every situation. And my experience working with these cats is that there's a lot of factors that determine their response to treatment. The environment and what we do in terms of treatment is probably the biggest one, but I believe that personality is a big factor. Because when we think about things like letting the cat approach at its own pace and when it gets comfortable, this works well for a confident cat in most cases. A confident cat, once it's not scared anymore, he's confident. I'm going to come up and say hi. Whereas a very, very shy or anxious cat might never approach because they're so shy or scared. They're more comfortable now. They don't think you're going to hurt them, but they're not confident enough to approach people. So with these cats, very different types of personalities, we need to do different things. So with our very shy and maybe anxious cats, we need to do things to increase their motivation, like experimenting with higher value food and different types of treats, and using other types of treatment, which we'll talk about a little bit later. I'm going to talk briefly about desensitization. This is another handout with dogs, I apologize, from Lily Chen, and it was the behaviorcompany.com is who has this particular handout. But what we want to do is desensitize these kitties to different aspects of home life and people. So we want to desensitize them to noises, spaces, movement, proximity to people, men, women, children, animals. Obviously, we don't have to desensitize them to all of those things, but when we do so, we do that so slowly and bit by bit and piece by piece like you see in this handout here. You also have a link to that handout, or you actually have a copy of that handout, I believe, so that we're not piling everything at once, because if we're presenting the cat with everything at once, we're flooding that cat. We're not desensitizing, is presenting the cat with that stimulus, whether it be a human hand or whether it be a person moving around, initially at a level that the cat can tolerate and is not fearful when they experience. I hope that makes sense. We're going to jump back to some of our survey responses too as we talk about other types of treatment for these kitties. So when we did this survey, we also asked about the influence of other cats. And was this cat friendly towards other cats in the environment? And over 50% said yes. Some of them said that it took some time. Some of the cats were sometimes friendly, sometimes not. And some of the cats weren't friendly at all. Others weren't exposed to cats. That's an important factor for me because some people report, and I've certainly experienced working with cats and dogs with very significant fear, that having a friendly animal can help that fearful animal to respond, whether it's because they see that friendly cat interacting and that helps them to realize that nothing bad is going to happen is the case, and that's why they're responding better. But numerous people definitely report that having a friendly cat can help the fearful cats. In other situations, it might be that being able to interact with a member of their own species helps them to come out of their shell and just be a cat and not think about stress and anxiety and worry, but just be a cat and interact with another being. My experience is that this is definitely something to try, but it doesn't always work. My experience is that super, super anxious and fearful animals, whether they be cats or dogs, will often just let the other cat interact. And they say, thank you, you're interacting with that scary person, and now I don't have to interact with them at all. So definitely not something that I've seen work universally, but it is something that I would suggest you try when you have a cat, especially when you have a cat that's friendly. And I would initially recommend doing it by desensitizing the cat, so introducing the cat at a distance to see whether the cat has any interest at all in interacting. Interestingly, also related to cats and multi-cat households, a recent 2013 study published in Applied Animal Behavior Science by Ramos looked at multi-cat households and stress levels, because many people talk about multi-cat households being very stressful for cats. And very interestingly and good was that this study found that they looked, glucocorticoids are a marker of stress, and they looked at glucocorticoid levels, and the levels were not significantly different whether it was a cat living by itself, with one other cat, or in a group housing situation. There were highly stressed individuals equally likely in all three of those groups. Young cats in multi-cat households had lower glucocorticoid levels, suggesting that, in my eyes, these younger cats like to play and interact with the cats with other cats, and so that's why they had lower stress levels. But otherwise, there wasn't much difference. So cats in multi-cat households were not more stressed than other cats. I thought that was really good information to gain, because there seems to be a lot of information out there that suggests that group housing is bad. And while it does take many cats quite a while to adapt, once they've adapted, they can certainly do quite well. All right, we'll jump on and talk about interaction with dogs. So not quite as positive towards dogs, but interestingly, some of the cats were friendly towards dogs. About 10% were friendly, and about 20% became friendly over time. But the majority of people didn't know because they didn't introduce the cat to a dog. And I would say that's probably a wise choice in many of these situations. These are animals that tend to be scared of sudden movement, scared of noises, and a dog is oftentimes not the best thing to introduce, although sometimes they'll be surprised. And we also asked, was the cat scared of noises? And overwhelmingly in this situation, people said that yes, these cats were scared of noises. And that fits with what we know about cats and stress, and that noise exacerbates stress in kitties. So a really important factor to consider when we're selecting foster homes for these kitties, when we're selecting adopters for these kitties, is we want quiet environments for them. So those are the basics of treatment. We could spend a whole day or two talking about this, but those are the basics. I want to talk a little bit about other options. Really, this shouldn't be an other options slide. It should be other things to do. Nutrition, in my eyes, being a very important factor, is that nutrition is the foundation of health, and making sure that that cat is on a good diet and a diet that is appropriate for that cat being very important. Considering things like Eastern medicine, Chinese medicine, using things like herbs and acupuncture. Acupuncture, probably a lot of you are laughing when I said acupuncture, because if you can't touch the cat, how are you going to use acupuncture needles? You're probably right. But herbs and things are things that can be added to diets to help these kitties. We can also consider using behavior medication. I'm not going to spend time talking about that today, but if you are a veterinarian listening to this lecture and want to talk about it more, please email me or contact me after this webinar. I've had very good success with some of our fearful cats using fluoxetine, which is Reconcile or Prozac, in cats who didn't respond, and we give them medication, and they respond very quickly, and we put the medication in food. Many people use things like Feel Away and Rescue Remedy. Mixed results there. Some people swear by them. Other people haven't had success. I haven't had very good success with Feel Away. If you're working with older cats, so we talked about the fact that older cats take longer to respond, I'd recommend considering that some of these things a lot more quickly. And really in any cat, if we're not seeing a response after 2 to 3 weeks, because 2 to 3 weeks is when in most cats, we started to see an interest in interacting with one person, that's when I really start to think about adding things in that are going to potentially help and are certainly not going to harm the cat. And there's pros and cons to everything we do, however, aren't there? All right. Now move on and talk about options for rehoming, although before I do that, I just realized, I apologize, I forgot to talk about one thing with regard to other options. Other options being things like catnip. Some of these cats can turn around with things like play. A lot of people reported playing with these cats really helped. Videos, bird videos. My experience with very, very fearful animals, being inside is just so scary to them that giving them exposure to the outdoors in some way, we're not going to let them outdoors if we're trying to get them into a home environment because we're never going to see them again, but trying things like bird videos so they're hearing more natural noises. Don't have research on that, but certainly something you can help. Experimenting with scents like lavender and chamomile that can be calming, all good things to try for these kitties. Trying a new foster home, something to consider too, because if the initial foster home did something that caused increased fear, sometimes a new person can have a fresh start and the cat can then respond. All right, jumping back to talk about rehoming. This brings us back to something that I talked about at the beginning of the lecture. Options should be based on the individual and related to the history, the cat's behavior, plus or minus the cat's response to treatment. What about releasing these kitties? You see it listed up there on the screen. If they're stray or feral, it's certainly an option to consider. There are people who are horrified at this thought. I don't want to release a stray cat because it's going to get hit by a car, killed by a dog. Something horrible is going to happen to it. However, for an unsocialized cat, the only other option is death. We have a shelter that isn't going to be able to find a home for this cat, and the cat is living in an inhumane situation in that shelter. It's something for us to really think about, and what is the best thing for this cat, and what would that cat really want. Research has demonstrated that community and outdoor cats are often healthy, in good condition, and live good lives. In some situations, living in an indoor situation is what we personally want for the cat. But over my career, it's not common at all, but I've certainly met a number of cats and dogs who prefer to live without people. They're happiest not having to ever be close to a person. And if we asked our cats, especially those 182 cats who never became comfortable in an indoor environment in our survey, some of these cats may very well live happier and less stressful lives outdoors. So certainly something to consider. And that's why the next thing that we're going to talk about are barn cat programs, which is kind of an intermediate option for unsocialized cats. And that leads us to our next poll.
Does your organization place cats in barn or warehouse homes? Yes, no, don't know, not applicable. Many shelters and organizations do place cats in barns and also warehouses in an urban setting. So please submit your answers on your screen, please, and we'll look at the results. Are barn homes good for these cats, warehouse homes? And let's look at our results here. Wow, that's interesting.
Yeah. Thanks for sharing your answers, everybody. And it's really exciting to me to see that 60% of you are placing cats in barn or warehouse homes. It is always so exciting to me to see in our industry how one person comes up with a good idea and everyone else jumps on it, and we help so many more cats by doing that. For those of you who selected no or don't know, it's certainly something that I recommend considering. And I'm going to talk about barn cat programs a little bit more right now. I'm going to talk about the barn cat program at the Animal Rescue League of Boston. And I want to start by saying thank you so much to Marianne Gasparo at the Animal Rescue League, who followed up on the cats in our barn cat program, which enabled me to share this data. At the Animal Rescue League, so it's in Boston, it's in a very urban area, but there are rural areas that are not too far away. And cats that go to barns are a very small subset of the population at the Animal Rescue League. Usually at the Animal Rescue League, these are cats that don't appreciate human handling. So these are oftentimes cats that the shelter has put up in an office foster situation. The cat is happy in office foster, but it still doesn't want to be touched very much. Some of these cats we adopt to an understanding home that doesn't need to touch their cats, but others go to barn cat programs. For the Animal Rescue League, it's a very small percentage of their population that go to these homes. Approximately 50 cats, or less than 1%, went to barn homes over a 3.5-year period. Some of the data about how the cats were cared for, because we were concerned about and wanted to do welfare checks, looking at these cats' longevity and health in the homes, and how they adapted to the homes. And Marianne found that on average, these cats were confined, so confinement was recommended initially while the cat adapted to the new environment. On average, they were confined for 2.5 weeks before allowed free access to the barn. And the vast majority of homes provide access to all of the following things I was going to say: shelter, food, water, veterinary care, flea, tick control. So these cats were taken good care of. Almost all of the adopters fed wet or canned food at night according to Boston's instructions. It's unknown how this helped. Some people feel that feeding that wet food at night encourages the cat to come back in the evening as opposed to keep roaming, but certainly something to consider. In terms of fees, because people talk about fees for these kitties, do you charge them, do you not? Some of the barns would have been willing to pay for this cat, others not. So that's just a brief bit of information about the Animal Rescue League's Barn Cat program. I encourage you all, if you do have a Barn Cat program, is to do follow up on these cats just like you would any other cat, so that we can ensure the success of these programs or find out that they're not successful. And I apologize, I didn't share the most important bit of information. 80% of the cats were still in the barn cat situation at the time of follow-up, so the vast majority remained in that environment. This here is just a quick and very cute and creative flyer from animalallies.net about barn cat programs serving the community. So that's barn cat programs, and certainly something to consider. The next thing we're going to talk about is placing these kitties for adoption. Some of these cats are way too stressed living around other cats or in busy areas, i.e. adoption housing, and we need creative strategies to find homes for these kitties. So at the Animal Rescue League of Boston, if these were cats that didn't go into a foster home and stayed in the shelter, which for us at this point with a very fearful cat, that cat would be in an office situation, we don't move them to adoption. Movement causes stress, and they tend to not do well. Their fear recurs in a new environment, and you're starting all over again. They're around other cats again. So what we do and did do at the Animal Rescue League of Boston is put cute little posters up, have a wonderful team of volunteers who create these posters for these kitties, and staff and volunteers know about these cats, so they very heavily encourage people to adopt when they have an adopter who walks in the door who might be suitable. We don't try to send these cats home with a loud household. We send them home with an appropriate household. When we talk about adoption counseling. You can see a couple words up there on the screen, but these cats need to be in quiet homes. Given that the vast majority of these cats in our study were scared of noises, this is a huge factor. We need to tell these people that many fearful cats, as we found in our survey, take more than 2 weeks to choose to interact with people, and that this can be normal. Educating people about what's normal, if you have a cat that's not interacting with them initially, and most people are going to expect their cat to interact with them right away. And if you tell them that it can be normal, you need to make sure the cat is eating and drinking and eliminating. But if the cat is not interacting with you initially and it's a fearful cat, that can be normal. It allows people to be a little more understanding and patient with the cats. So non-interaction can be normal, but about 50% interact in less than 2 weeks. So it may be quick, it may not. We can also talk to them and recommend that they follow the treatment steps that we outlined in this lecture, focusing on things. We don't want to give them too much information and completely overwhelm them, but focusing on things like decreasing stress, creating those positive associations, and not forcing interaction. And having them practice before finalizing the adoption. So having them in a foster home with a cat, so visiting that foster home with a cat, or visiting that office with that cat and having practice and making them aware of when they move too quickly, because they almost always do. Look what that happened with the cat. The cat got more fearful when you did that. So educating them as we interact with them. We can also tell them that many of these cats are going to be hesitant to explore the house and that they should initially keep them in one quiet room. Many of you in the study kept them in one room and kept the cats in one room. Some of you kept the cats in a large crate, and that's certainly another option for people to try. I prefer to give them more space, but there certainly are times and reasons where I will give them less. And over time, slowly increasing access to the house, and that it is normal that it may take months for that cat to be comfortable in the home. So really important to be realistic, and very nice that we have this survey information to share related to this. And lastly, we're going to talk briefly about post-adoption support. So providing the support after adoption is just critical for these kitties. Regular contact to determine if they're on the right track, to alleviate any fears they may have, and answer any questions. Appetite is and inappetence very, very common problem with these cats post-adoption initially. So tips to encourage them to eat, all those types of things, and answering questions so that they know that we're on their team and here to help them. And so that is the end of the lecture portion of this webcast, and I think we're ready for some questions now.
Yes, we're ready for some questions. And the first one, Dr. Darpino, was a response from Jacqueline. She was in the audience, and it's not really a question, but she's talking about the cat that was in your presentation. The cat had been feral, rescued by the new owner, but after 6 years, still no one but her could approach the cat except her. I was actually there to do videos of her cats that were having physical problems due to partial toe amputations. So that answers that question. Do you have a comment before we move on?
Yeah, first, thank you so much for sharing that. Very useful and very nice that you took advantage of that situation. And the cat was scared of you, it sounds like, and so you were just videoing Kitty being scared of you from a distance. Thank you for sharing that.
Okay, and here comes our first question of the night. Dr. Darpino, how do you balance the need to vaccinate, treat, etc. these cats with the need to give them space? Do you vaccinate, then leave them alone, not spaying until socialized? Does the spaying cause a setback in your experience?
That's a really, really good and a really interesting question. I'd love to see more research. Overall, yes, I recommend vaccinating them and then not doing anything unless in terms of medical treatment, except unless it's absolutely necessary. If it's necessary to spay them before they go to a foster situation, and I don't know an organization that doesn't spay before they go to foster situations, I recommend giving them an oral sedative in their food initially so that they're a little bit sleepier and less stressed about everything that's going on, and then giving them an injection so that they fall asleep completely for things like exams. So I believe very, very strongly in when we have a cat who's going to be severely stressed by things that are potentially painful, I prefer sedating them and anesthetizing them if necessary if they're very, very severely stressed. In some situations, we don't have that option. I'm going to talk briefly about spaying and does that provide setback. Very interestingly, when I used to be out in private practice, I'd get fearful puppies, and this is an answer about puppies, but it probably is similar in cats. And these puppies would be really fearful. Every vaccination appointment they came in, I'd give lots of treats, make a big effort to have a fun environment. And the puppies did tend to do really well. And by the time of their last vaccine, they were my best friends, and they were so happy to come into the veterinary clinic. And then they came in a couple weeks later to be spayed. And it was very, very common that experience of the spay kind of erased all of the work that I had done positively, because they had one probably significantly negative experience despite adequate pain control and all that, that caused setback. And I saw this happen many times. So I certainly think that these are things that can cause huge setbacks. And so I do think they are things to really think about and consider, and when you do have to do them, make sure you're doing things like using oral sedatives so that they're less stressed about that initial handling.
Great. Let's go to the next one, and this is a simple question. What do you recommend if the cat won't eat?
What do I recommend if the cat won't eat? So first, feeding at night, feeding when the cat is not around people, and that is what I most commonly have success with, is nighttime feeding. But some of the kitties we still won't have success with even that. I'll try a cafeteria of food options, so 5 little trays with 5 different types of food for the kitty, and give that in the evening. I will... in some situations where we're getting really desperate and not having any luck, you can't hide medication in the foods, but in some situations I have given injectable medications to stimulate appetite. This is something that I'm not going to do that unless it's a cat that I can handle. And if this is a super, super fearful cat that's also aggressive, I certainly can't handle it. I'd say the vast majority of cats that I work with, it's the feeding at night or when they're not around people. So you need to get them away from noises. You need to get them away from dogs and all those types of things into a quieter environment, and offer them many options multiple times a day. So I put those 5 little trays out, leave it there for 15 minutes, and then take it away. Because if I'm leaving that food out for 8 hours a day, it's going to look pretty gross after a while. So I offer food 5 to 6 times a day. And I'm not always going to be successful, but it tends to work.
Great. Let's go to the next question. Regarding enhanced socialization of kittens, what should not be done? Our shelter has a nursery where visitors can play with the kittens, but what should we watch for that could be harmful interaction?
Great question. Thank you for that one. So what you should watch for that could be harmful is people who are unknowingly overwhelming the kitten. So socialization is meant to be done at a level that the kittens are comfortable with, and a level of interaction that is not making them fearful. So if I have a 3.5-year-old boy, and I can guarantee you, if I'm not watching him very closely, he's going to make those kittens very, very fearful. So watching closely the interactions, the people behavior and the animals behavior, and if we see either interacting in a fearful way or in the people side acting in a way, making loud noises, things like that, stopping those types of things from happening. So things that are overwhelming, loud noises, forceful interactions, too tight interactions in terms of handling, those are really the big things.
Okay, here's another one. I have a healthy 15-year-old male in my care who has severe anxiety. He defecates or urinates when touched. He flees most of the time and hides. Is medication helpful? In this experience, his brother, the same age, is social and they play together. No physical trauma or incident.
So I would have a lot of questions about this cat that we probably can't answer, but I can suggest related to this cat. First, I'm not sure how long you've had this cat, when and whether he has always been this way. So if this is an older cat who was previously friendly and now has severe anxiety, not uncommon at all that this happens in older animals. In most cases, it's a sign of an underlying medical problem. So oftentimes there's an underlying medical problem that is causing them to be anxious. In other situations, it can be a sign of cognitive dysfunction, similar to Alzheimer's in people. But if this is a cat who, when he came to you, this was the behavior that he displayed, I would still recommend a full physical examination and blood work, which sounds like he would need to be anesthetized for to do it safely. But as long as he is physically healthy, yes, this is a cat who I would certainly recommend medication with, and I would suggest you talk to your veterinarian, and probably, if you're lucky, you have a veterinary behaviorist in your area who can help you with this kitty. And the website to find veterinary behaviorist is D as in dog, A, C as in cat, V as in Victor, B.org.
Okay, great. Here's another question. If you never force interaction for young kittens, then you potentially will miss the socialization period. For example, the kittens never get used to being picked up. Aren't young kittens an exception to your rule about not forcing interaction?
I think I planted that question in the audience. Yes, thank you so much for asking that question. Yes, you are right. So in kittens, through the process of socialization, we are interacting with them. Now, it's a tricky situation. Ideally, it depends what age you get the kittens, right? If I have a 4-week-old kitten, or even worse, better, a 5-week-old kitten that is very, very, very fearful, I know I have 2 weeks. And if it takes many cats 2 weeks to first interact, that cat's going to be at the end of the socialization period. So in an interest of saving that kitty's life and getting it to interact, I probably am going to force some interaction with that kitten, recognizing that I'm probably severely stressing that kitten, but I'm in this short period of time in this window where I'm most likely to have the best success with this kitty. So I am going to force it. I am going to do it for short time, very short time periods, seconds at a time initially, and then gradually longer periods of time. But yes, thank you for asking that, because kittens in their socialization period are an exception to the rule. We're not torturing these kittens with interaction. We're still attempting to desensitize, but I do completely recognize with these feral little kitties that we're going beyond what they're comfortable with in an effort to work with them in their socialization period.
Okay, we're going to take one more question, and then we'll go to our closing remarks here. What should be done with aggressive cat in a no-kill shelter that has been there for over a year but shows no improvement?
Difficult question to ask without more information, but an aggressive cat, I'm assuming because we're talking about fearful cats, that this cat is either fearfully aggressive towards people or it's a cat that doesn't like to be handled. So I don't know the circumstances. It could be territorial aggression. There's a lot of reasons why this cat may be displaying aggression. But regardless of the cause, if the cat is showing no improvement, something needs to be done. Something needs to be changed. Is it just that the cat is stressed by the environment? Many of these cats in shelters have wonderful environments with lots of space, but there's still things that they're not happy with. So I would really consider getting this cat in a safe foster home where the person knows how to stay safe around them. That can be challenging to find. The other thing I would really consider with this cat, difficult to say without knowing details, but medication would be something to really strongly consider, and I would also be using trying everything I can with this kitty, things like Feel Away, things like lavender in the air to get this kitty to respond. But difficult to give you more information without a more specific question.
Thank you, Dr. Darpino. I wanted to mention that we are giving away 10 CDs, What Is My Cat Saying, by Jacqueline Nunera. We'll be drawing from the live audience members, and we'll contact you via email. That's the end of our event tonight. We want to thank Dr. Darpino and all of you for your time tonight. Please click on the link to take our survey. It may have been blocked by your pop-up blocker, or it may be on a different screen. But don't worry if you can't see it. We'll be sending the link to you, and we would really appreciate it if you'd take a few minutes to respond. Make your plans to join Maddie's Institute on January 9th, 2014 for our next webcast, What Shelters Need to Know About Canine Distemper, with Dr. Cinda Crawford. The archived version of tonight's webcast will be available soon. Please visit our website and sign up for our newsletter, our blog, and show your support by liking us on Facebook. Thanks again for sharing your evening with us tonight. From all of us at Maddie's Institute, happy holidays. Good night.
Good night.